So in today's mini tutorial we're going to consider the very basic anatomy of the heart. And as I'm sure you're all aware, the function of the heart and the cardiovascular system as a whole is to exchange oxygen and carbon dioxide between two places, those being the body, so the peripheral body tissues, and the lungs. So the purpose of the cardiovascular system is to move substances between those two places essentially. And as you will remember, there are four chambers to the heart, and the heart is the pump which drives this system. So those four chambers are the right atrium, the left atrium, the right ventricle, and the left ventricle. The purpose of atria is to collect blood from veins and transfer that blood to the ventricles. The purpose of ventricles is to pump blood through arteries to target tissues. So let's consider the path that blood takes through this system, and we'll start off with some deoxygenated blood returning from the body tissues to the right atrium. And the major vessels that the blood returns to the right atrium through are the vena cava. We have a superior vena cava coming from the head and the upper limbs, and we have an inferior vena cava coming from the lower limbs and the rest of the body. This deoxygenated blood enters the right atrium, and from the right atrium it is passed to the right ventricle. And in going from right atrium to right ventricle, we go through a valve, and this valve is known as the tricuspid valve. So the tricuspid valve prevents blood from going back to the right atrium from the right ventricle when the right ventricle contracts. Now the purpose of the right ventricle is to pump blood to the lungs. And it pumps the blood to the lungs through the pulmonary arteries. So the pulmonary arteries transfer blood from the right ventricle to the lungs. And at this point it's quite useful to point out that it is not the case that arteries only carry oxygenated blood. The definition of an artery is that it carries blood away from the heart, and the definition of a vein is that it carries blood towards the heart. So in the lungs we pick up oxygen, so the blood becomes oxygenated in the lungs, and from the lungs the blood passes to the left atrium. And it passes through the left atrium through channels called the pulmonary veins. Once again, these veins are carrying oxygenated blood back to the heart. So the left atrium collects this oxygenated blood and then transfers it to the left ventricle through a valve, as in the case on the right hand side of the heart, and in this case the valve is called the mitral valve. And the mitral valve, its job is to prevent blood from going in the backwards direction from the left ventricle to the left atrium. Now the left ventricle contracts, forces blood out at rather high pressure, and delivers it to the peripheral body tissues, and that's through a major artery called the aorta. Before we move on to looking at these structures in more detail, I just want to point out a couple of things to you. First thing I want you to note is that the system is quite clearly separated into two halves, the left half and the right half. And these two systems have different names. So on the left side of the heart, this is known as the systemic circuit. So this half of the heart is pumping blood to the body systems, to the peripheral tissues of the body. On the right hand side of the heart, this is called the pulmonary circuit, and this side is responsible for pumping blood to the lungs. And as you can see, the two circuits do overlap, kind of like in a figure of 8 pattern. It's important to note, however, that at no point does oxygenated blood mix with deoxygenated blood. However, this is possible in certain conditions. You might have heard people described as having a hole in the heart, and this is where blood can mix between the right and the left atria, for example. In this case, the blood sent to the body tissues is a lot more poorly oxygenated, and so these children can sometimes have a blue colour, showing that they've got less oxygen in their blood. Additionally, I want you to note that blood only really travels in the direction of atria to ventricles. And this is important from the point of view of disease, because there are certain conditions where blood can pass in the reverse direction if the valves are leaky. And if that happens, we can get a whole number of problems with oxygenation of blood, or with increased pressure in, say, the pulmonary circulation. And I should point out at this stage that the pressure in the pulmonary circuit is a lot lower than the pressure in the systemic circuit. So let's move on and have a look at these structures in a bit more detail. So here is an anterior view of the heart, as if we were looking at the heart through the front of the chest. And the first thing that I want to point out to you is that the heart does not sit in the chest kind of suspended in space. It's attached, tethered to a number of neighbouring structures. And a major structure that the heart is attached to is the diaphragm. And as many of you will know, the diaphragm, it's a fibromuscular sheet, which is very important in breathing. And interestingly, because the heart is fused to the diaphragm, when you breathe in and out and your diaphragm moves up and down, your heart actually moves up and down a little bit as well. So your heart not only moves during its beats, but it also moves up and down during breathing as well. Looking at the shape of the heart, you might notice that it's actually the shape of a cone. Okay, so the heart is conical. It's an inverted cone. And just like a cone that you might have encountered in the context of geometry, it has a pointed end, which is called the apex, and it has a flat end, which is called the base. So you need to realise that the heart is an inverted cone with an apex and a base. This becomes important when we think about the electrical activity of the heart. Now let's try to identify some of the vessels going into the heart and coming out. First of all, I want you to look at the blue vessels that we can see on the left-hand side of the image, here and here. These are the vena cava. Okay, spell vena cava. And we have a superior vena cava and an inferior vena cava, carrying blood from the top and bottom halves of the body respectively. The next major vessel that we can see is this vessel depicted in red. It's a big vessel carrying blood at high pressure. This is the aorta. And you can see at the top of the image a number of branches coming off of it. These branches are going up to the brain and to the upper limbs. Next, we can see a kind of purpley coloured blood vessel, and this is called the pulmonary artery. So this is the pulmonary artery. As we said before, its job is to carry deoxygenated blood from the right ventricle to the lungs. And finally, some difficult vessels to see, because they're more hidden around the back of the heart, are these here. These are the pulmonary veins. And their job, as we said earlier, is to carry oxygenated blood from the lungs to the left atrium. Now the vessels that we've talked about so far are called the great vessels. So these are the big vessels going into and leaving the heart chambers themselves. But there are a number of other vessels, and these are vessels which supply blood to the heart muscle itself, because the heart, like any other tissue, needs a blood supply. So what we can see, for example, here is what's known as one of the coronary arteries. So in this case, this is actually the right coronary artery. And it's the job of the coronary arteries to deliver oxygenated blood to the heart tissue itself. And you can actually see at this point here that the coronary arteries arise from the first part of the aorta. So they're coming from the aorta itself, and they are supplying the heart muscle itself. In addition, we have a number of venous channels which are draining deoxygenated blood from the heart muscle. And as you might have guessed, these are called the coronary veins. There are many of them, and they're quite variable. And what these do is they drain deoxygenated blood from the heart muscle back to the right atrium, which is the common chamber that receives deoxygenated blood. So we've covered the great vessels and the coronary vessels. So now let's have a look at the chambers themselves, and let's try to see how we can identify the chambers. Now the secret to identifying the heart chambers is to look for the grooves which exist between the chambers, and these grooves normally contain coronary vessels. So can I point out this groove to you first? Okay, so here is a groove, and this groove is known as the right atrioventricular groove, and it separates the right atrium here from the right ventricle. So the right atrioventricular groove separates the right atrium from the right ventricle. Let's see which other grooves we can see. So here's another groove. And this is the groove which separates the right ventricle from the left ventricle. And it contains coronary vessels once more. Are there any other grooves we can see? Well, yes, there's a groove up here. And this groove separates the left atrium from the left ventricle. So that was the left atrioventricular groove. So looking for those grooves gives you a good method of identifying the boundaries between the four chambers of the heart. Now what we're going to do is we're going to cut into the heart and have a look at its internal appearance. And the part of the wall of the heart we're going to remove is approximately this region here. So in the next image I want you to imagine that we've cut through the wall of the heart there, taken that away, and now we're looking inside. So here we're looking inside of the heart. And just to remind you of the chambers that we can see, we've got the right atrium there, we've got the right ventricle here, we've got the left ventricle here, and we've got the left atrium there. The left atrium, by the way, is quite difficult to see in this view because it's mostly round the back of the heart. It's mostly hidden from view because it's sitting posteriorly. So let's have a think about some of the features that we can see now that we've cut through the ventricular walls. First thing to note is the thickness of the walls of the ventricles. So look at the thickness of the right ventricle here and compare it to the thickness of the left ventricle there. What you can see is that the left ventricle is a lot thicker than the right ventricle. And this is because the left ventricle pumps blood at a much higher pressure around the body tissues than the right ventricle, which only has to pump blood around and through the lungs. So the pressure on the right side of the heart is lower, meaning that the thickness of the right ventricular wall is a lot less than the left ventricular wall. Another feature that we can see is the interventricular septum here, and this is a muscular wall separating the left and the right ventricles. Now if we were going to look into the atria, we would see an equivalent interatrial septum, which is actually a lot thinner because the pressure of blood in the atria is a lot less than the pressure of blood in the ventricles, so it doesn't need to be quite as thick. We can see the apex of the heart, the apex of that cone, and the apex is mostly formed from muscle in the left ventricle. And also we can see a number of valves, and it's the valves that we're going to talk a bit more about in the next section. So we can see 3 of the heart valves in this view, and we've already given their names earlier on. We can see the tricuspid valve here, and this is the valve that separates the right ventricle from the right atrium. We can see the mitral valve here, and this is the valve which separates the left atrium from the left ventricle. And in addition, we can see a valve here, and this is the valve known as the pulmonary valve. And the pulmonary valve prevents blood going in the backwards direction from the pulmonary artery into the right ventricle. So it prevents that. So it's a one-way valve, and that's the case for all the valves. They are all one-way valves preventing blood going in the wrong direction. Now there's a pulmonary valve, and there is also an aortic valve, but we can't see the aortic valve. If we wanted to see the aortic valve that prevents blood from going back from the aorta into the left ventricle, we would have to be looking in this kind of direction up here, and it's hidden from view in this case, but it does the same job as the pulmonary valve. Now, looking in detail at the heart valves, we can see that their structure is a little bit more complicated than we might have at first imagined. So let's focus on the tricuspid valve. And what you can see is that we have a number of what are called valve leaflets. So these are the folds of tissue which are acting as that one-way valve. And basically what happens when the pressure in the right ventricle increases to a certain level, these valve leaflets move in this direction, and they all come together and shut. So the principle's a bit like this. So here would be, the atrium up here and the ventricle down there. Here would be the valve leaflets when they are open, and blood is able to flow in that direction. Now, when the pressure in the ventricles increases to levels which are greater than the pressure in the atria, the valve leaflets close. So these leaflets move upwards in that direction, and what we see is this situation down here, like this. So the pressure in the ventricles is high, and the blood is not able to get beyond. So that's what the valve leaflets are doing. Now you'll also notice that the edges of the valve leaflets are connected to these filaments. And these filaments are very, very important. They're called chorda tendinae. And actually these are the heartstrings that you might have read about in literature. So the chorda tendinae have a very important role, because what you might be able to imagine is that if the pressure in the ventricle was sufficiently high, it could actually blow the valve inside out. So can you imagine that these valve leaflets could be blown inside out, allowing blood to go from the ventricle to the atrium? And what the chorda tendinae do is they actually tether the valve leaflets and prevent the valve from being pushed inside out by high pressures in the ventricles. And furthermore, to assist that, we see that the chorda tendinae are attached to pieces of muscle in the ventricular wall. And these muscles are called papillary muscles. Papillary muscles. And it's the job of the papillary muscles to pull on the chorda tendineae and brace the valve leaflets. And they're part of the ventricular wall, and they contract at the same time as the ventricle. So they're pulling at the most sensible time during the cardiac cycle to brace those valve leaflets. Now, in certain cases following a heart attack, a myocardial infarction, these papillary muscles can die. So if the blood supply to the ventricle containing papillary muscles is cut off, the papillary muscles themselves will die. And that can mean that the valve leaflets are not being braced, the chorda tendineae are not under tension, and the valve itself can turn inside out. And this is a risk that the patients are subject to after heart attacks. They have this risk of valves becoming leaky because papillary muscles are no longer working. So I hope that you found this tutorial useful, and as always, please feel free to leave some feedback on the website, whether good or bad, so that I can try to make these as good as possible for you. Thanks a lot. Bye.